Hi, everybody. Thanks for joining us. I'm sure you've heard by now that the CDC has made their recommendation on booster shots. I would like to just remind everybody that our number one priority, and that's the priority of the CDC as well as the FDA and the Hawaii Department of Health, is to keep people from severe illness and needing hospitalization. And this means that people who are not yet fully vaccinated should have priority over all others. That's the real goal in our vaccination right now. The CDC and the Department of Health's strongest recommendation is for Pfizer booster shots to provide people 65 and older and those who are 50 to 64 years old that have underlying health conditions, those who have completed Pfizer vaccinations. And we want to allow them access to booster shots as waning immunity puts them at highest risk. We are also looking at booster shots for everyone. There is no need to get booster shots and rush out right now and go get them. We will have it for everybody. Please allow those who are not fully vaccinated to get vaccinated first, since they are at highest risk. And then please allow those who are at higher risk to get their booster doses next. As more supply becomes available, providers can then administer booster doses to the additional populations that were recommended for booster shots by the CDC. We're looking at the evidence. We're reviewing the conversations from the FDA and the FDA's advisory committee and the CDC as well as their advisory committee. Normally, the process goes from the vaccine referral advisory committee, and they make a recommendation to the FDA, and that recommendation then goes to ACIP, and ACIP then sends that to the CDC. What's interesting is that in this process, every one of those four entities made changes along the way, and that doesn't usually happen. So there's a lot of confusion out there, and we are just trying to prioritize our messages to please allow those who are not yet fully vaccinated to have priority and to get vaccinated first. And then we're going with the CDC recommendations for the two populations that they said should get boosters, and that's 65 and older, and those who are 50 and older who have underlying healthcare issues. Thanks. I'll be happy to take a few questions before I have to run.
I have a question. This is Jelani Martinez with Hawaii News Now. Dr. Char, is the health department worried about the pressure of prioritizing boosters, the pressure it would put on providers to triage people who believe they should be eligible based on what the feds are saying?
Well, I mean, we're trying to message clearly. This is stuff that all just came out late last night and early this morning. So we're working with our providers. We're very grateful that they're willing to, be a part of the solution in this community. So it's really going to be a lot of that. This is what the recommendation is, and we hope that people will follow it. We're not going to stand at individual vaccination sites and take full medical histories and make people prove things. But we would hope that they would honor that, because at the end of the day, it's all about keeping our community safe. This is the best way that we're going to be able to accomplish that.
This is Jen Buniza from KHON. I have a question regarding safety. There's been, it's kind of gone back and forth whether this is safe, it's not safe. Can you talk to me about safety? And is there going to be a booster shot eligible for Moderna and Johnson & Johnson?
So we know that the vaccines are safe. We know that they're effective. This is the most well-studied vaccine in the history of mankind. With regards to the safety data, if you notice that the Pfizer vaccine is approved for those 16 and older, but when it comes to the booster shot, it's 18 and older. And that's because the safety data and the clinical trials were done on those who are 18 and older. That's the data that they looked at. And so that's what the CDC and hence that's what we are sticking with, are those recommendations that have the most data that's been evaluated for safety. As far as Moderna and the Johnson & Johnson vaccine, I'm hearing that they're also looking at it, but I haven't heard anything yet with regards to a time frame for when they may be submitting for booster shots.
This is Sophie Koch with the Star-Advertiser. Dr. Char, how many Hawaii residents immediately qualify for the boosters? And is the health department looking to increase its supply in order to meet demand?
Well, I don't have an exact number of how many people are eligible. We do have about 90,000 doses in the state of Pfizer. I think a lot of those are at the Federal Retail Pharmacy Program, community pharmacies. And then there are other doses with some of our healthcare providers. Because you can imagine there's a great demand for Pfizer. So just as it was in the initial round of vaccination, we are limited in how much we can order. We have an allocation. So we will be ordering our allocation. And that's another reason to just remind people, let's go through this process calmly and let's use it where it will make the biggest difference to us. We will get enough vaccine for everybody who wants a dose. I see no reason that everybody needs to rush out and get it in the first week. Let's do it reasonably.
Hello, Dr. Char. This is Christine Donnelly from Kakul Line at the Star-Advertiser. Will Hawaii have enough Pfizer vaccine to accommodate boosters as well as first doses for children 5 to 11, which are expected to be approved relatively soon? Some officials have predicted by Halloween.
So with regards to boosters for children 5 to 11, again, that's an unvaccinated population. So if and when we get word that the vaccine is authorized for those 5 to 11, that unvaccinated population will absolutely be a top priority. And so that's where we're going to be able to get the most bang for our buck in protecting our community. So if and when we hear about authorization for that population, that's who we will be giving priority to.
Hi, Dr. Char, it's Annalisa with KITV4. Question about the other groups. I know you said the priority groups that you mentioned. Are you going to be factoring in, per se, people in hardest hit areas with low vaccination rates, maybe the frontline workers, and then under 50 population that are immunocompromised? Some clinics have been giving those booster shots to those groups already. So I'm just wondering, what's the messaging there in terms of, would those people be turned away now with your guidance, or will they continue to be able to get those boosters?
So our priority remains the same. If there are areas where people are unvaccinated or not yet fully vaccinated, that is the first priority. That's where we're going to make the most difference in keeping people out of the hospital, keeping our community safe. So for those who are not yet fully vaccinated, that's the priority population. Secondarily, we are offering vaccine to those who are immune compromised. We have been, and we will continue to do so, because those individuals, presumably, if they're immune compromised, they got their 2 shots, but they never really got to the level that everybody else got to for the protection. So for them, that 3rd shot is something that allows them to boost their immune system to get to that level of being protected. For everybody else who was at that level and perhaps now is seeing a little bit of waning, that's the populations for whom we're targeting boosters. And that's going to be those who are 65 and older, and those who are 50 to 64 years with underlying health conditions. So that's the prioritization that we're following to make sure that we do the most good for the most people in our community. And we try our best to keep people safe.
Can you just sorry, Sophie with the Star-Advertiser again, can you just clarify a little bit more on that point? Right now we have 230 sites throughout the state who are offering these booster shots. How do you sort of police it? How do you ensure that, because each site can't tell what the supply is. So who exactly is coordinating it and making sure that certain sites aren't giving out boosters to people who you haven't prioritized? I mean, how does that work? And are you basically telling providers not to give shots out to people who are younger that might have medical conditions?
So again, we are prioritizing those who are unvaccinated, and then we are prioritizing those who are immune compromised. And this latest ruling just came out for booster shots. only those who have received their Pfizer series and who are 65 and older, and then those who are 50 to 64 years old with underlying health conditions. That's who we're prioritizing right now. Obviously, I'm not going to go to every vaccine site and get histories from people and check their, vaccine cards or anything like that. So we as a community have a responsibility to each other to behave as responsibly as we can. And I think the providers have done a really good job thus far of trying to make sure that the appropriate people are getting vaccinated in a timely fashion. I would ask that people take their vaccine cards with them when they go and get vaccinated, because that'll allow us to ensure that they did get the proper vaccine for the booster, and also that they're within the appropriate time frame, because we want to make sure that people are at least 6 months out before they're getting their booster shot.
This is Zoe with HPR. Could pregnant women get the booster shot?
So it's unlikely that a pregnant woman would be in the categories of the 65 and older or the 50 to 65 with underlying health issues. If they are, they would absolutely be in one of those two priority groups. Those are the groups that we're targeting right now. If there's a pregnant woman who is not yet fully vaccinated, absolutely that person should get vaccinated.
The CDC has a list of underlying medical conditions. And so we wanted to know, will the providers be looking at all those underlying health conditions or only specific ones?
So the recommendation right now, again, is listed on the CDC website. Please remember, we're asking people to help with the vaccination. These are not sites that are going to, delve into your personal medical history and get a full history on you before offering a vaccine. I think if people have questions, we would really like them to call their healthcare providers and ask their healthcare provider if it's appropriate for them to get vaccinated or not.
Can you clarify, what is the state allocation of the Pfizer vaccine? I think you said that there were 90,000 doses in your supply, but what do we get every week?
So we're still waiting to see what the allocation will be to the state. We just know that when we constantly track vaccine within the state, and I believe at last check, we had roughly 90,000 doses of Pfizer within our state. So we're still waiting to see what the exact allocation will be. Please keep in mind, we're going to be one of 50 states that's looking for additional doses of Pfizer. And so we're waiting to see what that turns out to be. We'll go from there. We'll get it to where it needs to be, and we'll go from there.
And last question.
Dr. Char, could you please clarify, does that 90,000 include the doses that are being dispensed by the local pharmacies, CVS, Walgreens, Costco, or do they have a separate allocation beyond that 90,000 dose?
So that 90,000 is what we currently have on island according to the federal databases that we can access. So yes, it includes that. In terms of the allocation comes to the state. Some of the retail pharmacy programs up till now have been getting their vaccine supply directly from the federal government. So I'm assuming that it will continue. Again, this just dropped, like 12 hours ago. So we're still waiting to hear a lot of the details from the feds. But I imagine that it would be continued in the same fashion that we've been doing vaccine for the past 8-9 months now.
And Dr. Char, any closing remarks?
Yeah, I just want to thank everybody for being patient. This information is brand new. It's kind of unprecedented that we've seen so many changes from the recommendations from the FDA and their advisory committee to the CDC and their advisory committee. So we're also trying to be flexible and go with it. We will get people booster shots if they're interested. We just ask that people be patient. And please keep in mind that we're really trying to do the greatest good that we can for our community. Number one priority is those who are not yet fully vaccinated. And that will include those 5 to 11. So if and when those individuals are eligible and are interested in getting a vaccine, that's the priority group. We welcome all those that are not yet fully vaccinated who are currently eligible to please come forward and get vaccinated. And thereafter, we will use our doses for booster shots where it's appropriate, and we're prioritizing those who are 65 and older and those who are 50 to 64 years old with underlying health conditions.
Thank you everyone for joining us.
Thank you.
Thank you.
Thank you.